All right. Welcome, everybody. My name is Aaron Broadwell, president of Coalition of State Rheumatology Organization, CSRO. And we're going to be doing a town hall around state advocacy and kind of the state of the states for 2026. I'm a rheumatologist in Shreveport. I've been the proud president of CSRO for the last year and for the next couple of years. So most of you know advocacy is really our cornerstone of things that we deal with at CSRO. We help really in all different types of areas. We're looking at the federal level, the state level, the regulatory levels. Tonight, we're going to be focusing on state and what's coming up over this next year. We're going to hear from our government affairs team. We've got Jessica and Darcy on. They're our main state folks at Heart Health Strategies. We appreciate all they do because there's only 50 states for them to take care of. But we know that working at the state level, which I think has been pretty unique for CSRO, really helps to gather steam and ultimately leads in federal legislation changes. But also, there's just a lot of things that we have to do at the states level, and rheumatology is pretty unique. You know, when I've talked to our state medical society, our priorities don't always align. So I hope this is educational for everybody. This will be recorded, and please, if you have questions, put them in the Q&A box, not the chat box, and we'll kind of get to those during the presentation or at the end. With that, I'm going to go ahead and turn it over to Jessica and Darcy. Thank you all so much for joining us. They kind of run everything for us at CSRO at the state level. So thank you.
Awesome. Thanks so much, Dr. Broadwell. I'm Jessica Frasco, and I'm joined tonight by Darcy McLaughlin. We are just two of the four government affairs staff that work with CSRO, and we are really have the pleasure of running government affairs, as Dr. Broadwell said, across all 50 states. Tonight, we are really going to focus on why your voice matters. So Dr. Broadwell mentioned that, we're going to talk about rheumatology's unique perspective in the state government affairs fights and in the proactive issues that we work on. But why do state legislators need to hear from rheumatologists? We're going to really focus on that tonight because your voice is really important. First, we're going to dive into a recap on CSRO's 2025 state advocacy efforts. We'll talk a little bit about what's happening in state legislatures in 2026 from a broader perspective. And then we're really going to dive into why your voice as a rheumatologist matters and the tools that we have with CSRO at your disposal to make sure that your voice can get heard. Darcy?
Thanks, Jessica. So before we get in to the issues tonight, we just kind of wanted to highlight last year, and 2025 was a really successful year for CSRO on the state advocacy front, thanks to its increased advocacy efforts and strategic plan, as well as increased bandwidth. We increased our state advocacy footprint by 540%, which is substantial. And kind of what makes that up? How are we so successful? As you'll see here on the slide, some of the key highlights to make sure that CSRO's voice was heard, not only in certain states, but across the whole nation. We were tracking 382 of CSRO's priorities. So we'll get to that in a little bit, but these are the issues that matter most to rheumatologists and their practices. So we were monitoring them at every stage and juncture throughout the legislative process. And then at critical points where those priorities were needing engagement, whether they are being threatened or they were advancing, CSRO staff was engaging on your behalf with letters and organizational comments that were sent to state lawmakers and governors articulating CSRO's positioning to make sure that our voice was heard. And then finally, as part of that footprint, CSRO activated 32 grassroots campaigns across 22 states. And those were instrumental because not only did it reaffirm CSRO's position, but it also got all of the 22 state involved with their state rheumatology organizations and advocates in those particular states to really show the grassroots and local voices, not just a national voice coming in, and to show the implications of these policies at the state levels. So this was a really exciting year for us. A lot of momentum was made, and we're really looking forward to building on 2025 moving into 2026, given those significant efforts made. And then as a result of that increased advocacy strategy that we just talked about, we saw a lot of CSROs priorities signed into law, which is really positive and just shows that kind of that that strategy, making sure that, where we're dedicating resources, but also increasing our efforts at the state level yields results. I think quite often there's the question of, is any of this worth it? And this past year definitely demonstrated that there were some really great successes on CSRO's priority issues. So I won't get into all of the states, but I just quickly wanted to kind of highlight some of the key wins that we saw. So this past year in 10 states, there were prior authorization restrictions passed, which was a huge win. Also, CSRO has been extremely active on PBM reform. And this past year, we saw the first delinking law passed in Colorado, and then shortly after, California also implemented delinking provisions as well. And then moving on, still on the topic of PBM reform, we saw 6 states also pass rebate pass-through provisions. And in addition to that, we saw some great movement on copay accumulator bans, as well as bans on maximizers and alternative funding programs. So we saw 5 states pass bans on copay accumulator programs, now bringing the grand total to 26 states. In addition, DC and Puerto Rico, which is now more than half of the country. And then we also saw Indiana and Maryland, in addition to that, pass bans on alternative funding programs and maximizer programs as well, showing that states are also taking additional efforts to kind of put mechanisms in place to really hold insurers, PBMs, and also these third parties or alternative funding programs accountable. And then finally, just the last couple policies really quickly, we saw in 3 states, biomarker testing coverage mandates passed. Arizona also passed a non-medical switching ban. And then we saw the needle continue to move on step therapy exception protocols in 4 states as well. So again, just want to really highlight and thank you all for your continued advocacy at the grassroots level and engagement with CSRO leadership. It really helped move our key priorities along last year and get them signed into law. And then with that, I'll turn it back to Jessica. I know we're going to kind of talk about the year ahead and what's in play.
Awesome. Thanks so much, Darcy. So we are in session. This is for CSRO our busiest time of year. It is when all the states that are going to be in session for the year are active and are moving. We are hitting the ground running. We are tracking introduced legislation. We are already seeing bills move and advance through committee, through key votes on either the House or Senate floor. And so this is kind of our prime time. Legislators in 42 states have already returned to their state capitals. We'll have a handful of others like Louisiana, North Carolina, Arkansas that join us a little bit later this spring. But notably, Montana, Nevada, North Dakota, and Texas are not in session in 2026. So in those states, they only meet every 18 months. And then they are out of regular order for the rest of the year. So we will not see legislation advance in those states. With the exception of New Jersey and Virginia, 2026 is an election year. So that means a lot of our state legislators will be campaigning and on the ballot in November. And because of that, a lot of state sessions will be shorter this year, which will allow for more time for them to be campaigning. With that, the majority of our states will likely adjourn by around June 1st. So again, this is our crunch time from January to really June, where we are going to see the majority of our state legislative action. This session, we anticipate to see a lot of debate around state budgets, and that's because states have experienced slower revenue growth. We're seeing rising costs. With the federal government cutting state funding for Medicaid, we're going to see some impact there. So budget concerns are really going to be a key issue that's going to drive a lot of the policy decisions this spring. CSRO advocates for state policies that directly impact the practice of rheumatology and impact our patients and their access to essential medical care. So when we're looking at issues, what do we look for? We're asking ourselves, will this bill make it easier or harder to practice medicine and maintain a practice? Will this make it easier or harder for your patients to get the medications that they need? If the answers to those are yes or no, CSRO will then use those to identify our main policy priorities every year and engage on those issues across all 50 states. We've broken those issues down into 4 areas: protecting ensuring patient access, we have PBM reform, protecting physician practices, and then last, utilization management reform. We don't have enough time tonight to really talk about all of those issues in depth, but we'll dive into a few of them and talk about how rheumatology's perspective on each of those issues may be unique, and therefore it's an important perspective to voice during these policy debates in your state capital. For any of the issues that Darcy and I don't cover tonight, please visit csro.info/advocacy/our issues, and you can find tons of information there. You can also go on the CSRO website and find state correspondence under the advocacy tab, and you'll be able to see all of the letters that CSRO submits on behalf of rheumatologists in your state.
Thanks, Jessica. So we'll now kind of dive into some of these priorities and most importantly, why it's really important that you get involved and your voice matters on these particular CSRO state priorities. So the first one we'd like to talk about is copay accumulator adjustment program bans. So just as a quick reminder about the issue, as we all know, about a quarter of adults say that they're having difficulty paying for their prescription drugs each year. And, specialty drugs in particular are extremely costly. You all know in particular that rheumatology patients usually feel the biggest brunt of those costs. And, as a way to overcome this, drug manufacturers have created these copay assistance programs. Where they'll give coupons to help pay for specialty drugs. But unfortunately, in recent years, we've seen insurers and PBMs kind of use those coupons against the patient, where the patient, may see a discount up front at the pharmacy, but unfortunately, that's all they see. The copay assistant will not go towards their deductible or their maximum out-of-pocket limit, which is kind of one of the key issues here at stake and kind of why it really matters to you all. Because as we know, rheumatology patients sometimes have some cost sharing obligations up to $5,000 per month. So these patients really are facing financial struggles. And the fact that health plans and PBMs are getting in the way of them being able to use these copay assistance programs by having these adjustment programs going in and kind of, in a way, blocking them and taking kind of the financial benefits of them from the patient. They're essentially kind of defeating the purpose of the co-assistance program to begin with. So as a result, what can you do about this? Why should you care, right? I think the first one from just a practice management perspective, of course, is, as I talked about, rheumatology patients have really high out-of-pocket costs. So if they're not getting these copay assistance, they're more likely to stop or delay their care. So they'll be less likely to see you. They might stop that altogether. As you all know, these patients are very vulnerable patients, and that can be life-threatening. It can also lead to, emergent symptoms, them going in and out of the emergency care and really setting them back from the treatment plans that they had in place, which, deters and sets back the progress that you've made as the provider. Also, it creates a lot of administrative burden as well, I'm sure for your offices as well, trying to figure out, how much you can help your patients. I think the other thing as a provider that often is a burden that you all have to deal with is you are kind of the face for your patients, right? So you are the educator in many ways of the complicated drug supply chain that we have in place, whether you want to be or not. And you have to kind of educate the patient about that process. And unfortunately, you're often the one that has to kind of go back to them and explain why it's not covered or not, and kind of find workarounds to try to keep them on that treatment, right? When at the end, they don't understand because this program was in place to benefit them, right? So this is not only a way for them to get kind of the intended process, the intended benefits of the copay assistance program, by creating a ban on the adjustment programs used by insurers and PBMs, but also to make your job easier so you can do less education. So I think kind of what you can do to kind of help with the issue. As I talked about earlier, there's been a lot of great momentum on passing legislation that bans copay accumulator adjustment programs or restricts them across the country. I think one of the best things that you can do is kind of testify when these come up across the country. But I think one of the most powerful things that we have seen with lawmakers as this has unraveled with policy debate is really collecting patient stories. I know we kind of heard of that. Unfortunately, one of the most consequential examples of the young child who had lost his life because of a copay accumulator program with his inhaler and asthma. But if you can find other examples of copay assistance being blocked by these adjustment programs and your patients being denied or delayed care from your own personal experience that we can use to educate lawmakers, that's kind of one of the most powerful ways that you can kind of help support not only when we're communicating with lawmakers, but help making this a little bit more personal.
Great stuff, Darcy. Thank you. So next, we're going to talk about the 340B program. So the legislation's been introduced for probably about 4 years now around this issue, and it would expand the federal 340B drug pricing program. And just as a way of background, this federal program began as really a noble endeavor to really help safety net providers deliver more affordable care to uninsured and to our underinsured patients. And it was specifically created so that qualifying hospitals and clinics could provide discounted outpatient medications to their patients. But over the years, this program has really strayed from its original purpose, and it's become really lucrative for some of these covered entities, including disproportionate share hospitals, where far too often these profits are far outweighing any benefits for the patient. So why should you care as a rheumatologist? We see that the unfettered expansion of this program has a direct threat to private practice for those of you who are buying and billing. Unfortunately, the program plays a strong hand in healthcare consolidation that continues to threaten private practices across the U.S. Covered entities like disproportionate share hospitals and their off-campus facilities, they have a competitive advantage when they can purchase drugs at a 20 to 50% discount through their 340B status. And that is a discount that you will never have access to unless you are part of the 340B program. When you account for drug, patient, and geographic factors, price markups at 340B eligible hospitals were over 6 times higher than those in independent physician practices. That's just an unlevel playing field that rheumatology practices will never be able to make up and will make us even more susceptible to hospital acquisitions. In fact, large 340B hospitals are actually responsible for about 80% of hospital acquisitions of private practices. So we're already seeing this happening. So why does your voice matter? Why do legislators need to hear from you on this issue? The additional revenue that's covered entities can pocket from this program, that provides them with a cash flow advantage that your physician practice and other outpatient clinics will never be able to actualize. State legislators need to hear from you. They need to hear about the important role your office plays in the community and the convenience of having your office in the community for their patients. They need to understand why it's not okay to push immunocompromised patients back into the hospital system, which is what will happen if your office is not able to provide that care for those patients. And they need to understand that policies like this that further empower hospitals over independent practices, they're going to threaten the viability of your practice in their district and in the community. You are a constituent. You get to vote for them. You need to demonstrate to them why you are an important part of the community and why your presence needs to be maintained. Just to be clear, CSRO supports the 340B drug pricing program, but we just believe that the program requires guardrails that promote trust and accountability, ensure patients are the beneficiaries of the program instead of large hospitals, and that don't directly threaten the viability of private practice. Darcy?
Thanks, Jessica. So now we're going to talk about rebate pass-throughs, which is one of the PBM reform provisions that CSRO has been advocating for. So this has been kind of one of the key policy reforms that CSRO has been advocating for, and has been arguably kind of one of the more amenable reforms that have been accepted by lawmakers that we've seen more progress on over the past couple of years. And, kind of just sort of the backstory on the issue over the past couple of years, PBMs have kind of been negotiating aggressive and deep drug manufacturing rebates for patients. And they're kind of doing it under the guise that it truly isn't intended to benefit patients as another cost-saving mechanism for them. But the problem is we're seeing once again that these alleged savings are not being passed on to patients. In fact, we're seeing, a very small percentage of these drug manufacturer rebates trickling down to the patients. Instead, what's happening is we're seeing PBMs benefiting benefiting from majority of the drug manufacturer rebate and price concessions, leaving the patient with, hardly any benefit at all. So what they're doing is they're negotiating these really great drug manufacturer rebates on behalf of the health plans that they're vertically integrated with, and then taking most of the financial benefit, and then the patient is still stuck paying a very large portion of a drug list price, because kind of back to the vertical integration component. PBMs and health plans have then kind of strategically then negotiated for higher list drug price than to be on the formula. So they're getting a greater percentage through this process. So I guess kind of why should you care about this? Again, this kind of goes back to the fact that, your patients are financially struggling to pay for their prescription drugs and also their deductibles. And, rheumatology care is very expensive. And if they're not able to get access to their drugs and these rebates that are truthfully intended for them, but are getting stuck within this PBM process that's vertically integrated with the insurers, and not being passed down to them as intended, they're not going to see the financial benefit, and then their continuation on those drugs are threatened. And again, that potentially leads to a delay in care or them ultimately stopping treatment. So why does your voice matter in this? Why has this debate picked up, and how can you help in this debate? So I think one of the key things that is really important is kind of shining light as part of this debate into the vertical integration between PBMs and health plans. I think that's kind of a key argument that we've been very successful in, and kind of showing how rheumatologists, providers, and patients are quite frankly combating against, three kind of healthcare conglomerates that are all vertically integrated with interest in health plans and PBMs, and they're controlling the marketplace and the profits, and leaving patients and providers with very little financial benefit as intended. So I think that's one of the first things that, you can do as you're talking with lawmakers, educating the public about this, about, how complicated this process is, and really kind of where, follow the dollar, where the money's going, and kind of who's holding on to it at the end. CSRO's position on this is that, we want to make sure that these drug manufacturer rebates, 100% of them are passed on to patients. That's what we advocate on at the state level. So we appreciate that, when you're weighing in with lawmakers or weighing in on this debate with your colleagues or the public, to kind of educate them about this issue, or even your patients, reiterating, how it's critical that, the rebates 100% go to the patient as implied, that PBMs are not compensated for the majority of the rebate, that this is really, the program is intended to help patients who are struggling so that they can get access to their drugs. So those are kind of the key things that you can do to kind of help advocate on this, make sure folks are aware of this. But I think we've been really successful on PBM reform in general by highlighting, the overwhelming reality that, 80% of the healthcare industry has direct vertical integration, and there's been a lot of oversight not only by Congress but a lot of state attorney generals. So anything to kind of continue that narrative and talk about how this is negatively impacting patients who it was intended for is critical. And then with that, I will turn it back to Jessica.
Great. So Darcy and I just went through 3 different issues that touch on 3 of the 4 policy pockets that we talked about earlier. And now we're going to talk about the tools that CSRO has made available to make sure that you can voice your opinions during these policy conversations. So the first one we're going to talk about tonight is the CSRO map tool. And CSRO has long had a map tool that allows rheumatologists, their practice partners, and patients better understand the bills and enacted laws that impact the specialty. But this January, CSRO relaunched this feature with the next generation usability. And it's pretty amazing, to be honest. We're very excited about it. So just a few of the features that you'll see on the CSRO map tool, which you can visit by clicking on this QR code in the corner and going directly to csro.info, go under advocacy, and you'll find the map tool there. So some new features that are included in this next generation map tool include information about your legislative session. So when is the start date of session in my state? When does it end? Is legislation in my state able to be carried over from year to year? You'll also find information on how to file a complaint with your state's Department of Insurance. You'll find direct links to a zip code locator that can help you identify who your state legislators are and find information about how to contact them. And you'll find a direct link to request assistance with private payer issues, which is a feature that CSRO offers to rheumatologists. That's all at the top of every single state map tool feature. Then once you dive into the site further, underneath the filter legislation, you're going to see where CSRO has been engaging on our policy priorities. So you'll see in green legislation that is new and has been introduced this session. And you'll be able to also see when there are opportunities for you to take action and participate in an action alert. You can also read the bill text if you're interested in reading more about the specific legislation. There is also a feature in blue, which will show you all of the existing laws within CSRO's policy priorities. And once you dive into those areas, you'll find more information about the laws that have been enacted. Newly launched with this year's map tool next generation are these new worksheets. And the new worksheets provide you with an in-depth understanding about how these new laws impact your practice. So it's great that CSRO is doing all of this advocacy work in order to try and pass proactive legislation. But then what happens after that? We're making sure that your team and that your practice has the information on how to implement and execute those laws to the fullest, to make sure that you know about the protections that your patients have under the law, which health plans the law applies to, and then information about filing a complaint if your state insurance department if the health plan is not complying with the state law mandate. All of these worksheets are printer friendly, so you can print them out and use them within your practice. And hopefully that'll make it easier for you and your team to fully understand the benefits of the hard work CSRO did to get these bills enacted into law. We also want to highlight the Action Center. So within that map tool, if you see a button under any legislation that says Take Action, it will bring you to the CSRO Action Center. You can also find the Action Center by clicking on the QR code in the corner, or once you're on csro.info, you can go under Advocacy and you'll find Action Center there. CSRO is only as strong as its membership, which is why it's really important for rheumatologists and their practice partners to join when these issues are being posted on the Action Center and make sure your voice is heard. A lot of people ask, do these letters really mean anything, right? If I enter my zip code and if I sign up for alerts and if I submit this online form, does that really do anything? And the answer is resoundingly yes. We regularly hear from congressional offices and the offices of state elected officials about the number of letters that they have received on a specific issue. And the truth of the matter is, if they hear from constituents about an issue, they're more likely to engage on it. If they don't hear from you or only hear from the opposition or the opposing side of our position, then they're less inclined to take our position, right? So the squeaky wheel, is really what we're trying to achieve through this Action Center. Those offices are counting those letters and they're making the decisions based on who they have heard from. So if you have not signed up for CSRO Action Alerts, please use your phone to use the QR code in the corner, go onto the page, and you'll see an opportunity to sign up for alerts. We also encourage you to, when you see these email alerts or these alerts come through email, to participate in them. They're also always posted on our social media, so you can see them there. Truly, we make these letters as simple as possible where you have the opportunity to personalize, but you don't have to. We're going to give you all of the talking points already, and you can allow your voice to be heard by simply pressing submit. That truly can make a real difference.
So, in addition to that, we also want to talk about other opportunities for you to get involved at CSRO. So, one of the first ones is we want to remind you that state rheumatology societies have the opportunity to apply for a state advocacy grant for up to $5,000. And that can be used for a variety of advocacy opportunities and educational resources. Most regularly, they're used for kind of state lobby days, volunteer training, or educational policy webinars. But our team is also happy to work with you to kind of, see, what that can be used for based on your needs. But we want to encourage you to take advantage of those opportunities to kind of strengthen your state society's advocacy work as well. So additional opportunities, we want to make sure that you're encouraged to host a state advocacy day, or if your state rheumatology society is already hosting those, to continue to do that. As we mentioned earlier, we've had a lot of success at the state level, and that's largely in part to the on-the-ground grassroots engagement. And we really thank our partners and our state rheumatology societies for getting in the door at the state capitals, putting a face to the name, and meeting with lawmakers, because politics is very personal too. So it's really important that we share a position, but also make that personal connection. So If you have the opportunity to host a state advocacy day, or if you're already doing that, we encourage you to continue to do that as well. And make sure that rheumatology priorities are shared with your state lawmakers. In addition to that, you don't have to wait till once a year for the opportunity to participate in an advocacy day. Throughout the year, there are hearings on CSRO's priorities that we talked about earlier today, where the general public can come and testify in favor or against a policy position. We encourage you, if you have that opportunity and you hear from your local state society about one of these upcoming hearings, whether it be a health committee that's hearing one of CSRO's priorities, that you go and testify, share your personal experience, your patient experience, so that they can hear exactly how this is impacting your practice and your patients. And then the next opportunity that we wanted to highlight is to invite your elected official to your office. This is actually one of the most worthwhile opportunities. I think folks often wonder, will they actually want to come? I think this is one of the most memorable ways to build a relationship with your lawmaker. Of course, going to the Capitol, you're definitely going to foster relationships, but just from working on the other end with politicians, I can tell you that they will always remember you if they went to your office 3 years ago and saw patients, or was upfront, while phone calls were coming in. They love that stuff. Any opportunity to kind of get there on the ground and see what you do. It kind of just puts what you do in practice and lets them see firsthand exactly, what's going on. If you're thinking of doing that and have any questions, kind of like privacy concerns, please feel free to reach out to us. But we strongly encourage you to, take them up on that opportunity. If they say no because it's session, reach out again when things are closed. Reach out when session's over. They might have a little bit, more freedom with their schedules, but that's also a really great opportunity also to build a strong relationship. And then finally, we also want to encourage you to take the opportunity to author op-eds in your local newspapers and news, whether that even be online or local print. These are really great opportunities for you to kind of share CSRO's position, gain the attention of your local lawmakers as well. Again, lawmakers want to hear from you. They care about what their constituents are saying about them. And, they really care about getting reelected. And one of the ways that, their viewership and their public opinion is shaped is, through the news. So these are great opportunities to, not only shape their opinion, but also draw attention to CSRO's policy priorities. And if this is of interest to you, please reach out to us. But we've had a lot of our members and leaders participate in op-eds throughout the country, and they've kind of garnered a lot of great support in each of those states to kind of help move the dialogue on those policy debates. So, and then next slide, if you don't mind. And then finally, we wanted to flag for you CSRO's annual advocacy conference. This year, we are going to be hosting it in Washington, D.C. on October 2nd to 3rd in our nation's capital. So we're really excited about this opportunity. It will be formatted similar to the past, where we will have a focus on state advocacy efforts and initiatives, and have the opportunity to talk about the priorities that CSRO is doing for you at the state level. That will not change just because we're in DC, but it'll also be really great that since we're in Washington, DC, that will also be kind of in the epicenter where some of the greatest health policy thought leaders are located at. So we'll have the opportunity to bring them in so you can hear directly from them, as well as lawmakers, about CSRO's priorities and how you can get involved and engaged in the process. And then I know that the official registration, I don't believe, has officially launched, but I know CSRO is kind of collecting names right now to kind of send out an alert for once it does launch. I can share that link for anyone who wants to sign up, but also please continue to watch our publications and our newsletters as soon as that registration launches and goes live. That'll also be included in the forthcoming publications, so you won't miss it as well. But we hope you can join us in DC in October so we can continue the conversation and talk about more ways for you to get involved in our advocacy process. And then I think with that, that is all we have for tonight. I know we're going to kind of use the remaining amount of time for questions and answers. I want to see if we have anything in the chat here. I'll turn it back over to Dr. Broadwell.
Yeah, thanks, guys. I mean, and really props to Jessica and Darcy. They have just revolutionized this map tool. We're trying to make it as easy as it possibly can. In there, again, she said, I'm the chair of the payer issue response team. So if you feel like somebody's not listening to what the laws are, you got a link to come tell us about that. I think there were several things in the chat around. Let's see here. Just kind of some representation type things, and I think Dr. Solsky, we can get with you about Kansas in particular and what can be done there. I'm unfamiliar with exactly what's going on, and Dr. Goldman will definitely get with you about 340B stuff. Please, I would recommend everybody go to your state and go make sure it's all looking right and working and everything. We think we've worked out all the kinks on it, but we did launch it last month, and so somewhat of a new tool and hopefully going to be very helpful. Let's see here. Some questions around the advocacy conference. We typically have not been doing that virtually. I don't think that there's any current plans to, but we'll get back with you, Dr. Goldman, and we do have your email for trying to help out on the 340B work you're going to do. Thanks for doing that. We'd love to get, everybody, if you don't know your representative, if you haven't met them, we can certainly get you the info, try and arrange some meetings. Again, getting those connections is huge. Yes, politics are at play, but the more they hear from us and the more they have some personal connections, the absolute better it goes. So, question about Trump RX. My understanding, and if anybody knows differently on this, y'all correct me, is Trump RX is supposed to be something that's going to be kind of going to some of the direct to manufacturer purchasing that can be done, such as Lilly Direct for the tirzepatide type medications, et cetera. It doesn't seem to be something that is going to be affecting us very much because it's more of a direct to consumer purchasing program, and it's not going to actually be a pharmacy. Um,
Yeah,
j-
Dr. Barlow, I can add on to the Trump RX
yeah.
since our team all does both state and federal work. So Trump RX will not be available for all medications. It will only be available for some. As you mentioned, GLP-1s are a big one on there. A lot of the manufacturers, I think there are 15 to date that have done agreements with the White House on drug pricing. They have each had to commit to some of their drugs being on Trump RX. I think the big thing to consider when I think Dr. Goldman had asked, will this help our patients? Will this help us? In a way, Trump RX is actually just skirting insurance responsibilities because your patient is not allowed to submit their purchase from Trump RX as part of their out of pocket. And so those will not go towards their deductible or their maximum out of pocket spend. And so instead, that's just dollars that go out of their pocket. Meanwhile, they are still, or their employer is still paying for insurance. So if patients are able to access medication for a cheaper amount than it would cost them for their out of pocket for that medication, that's great. But at the end of the day, it actually doesn't address the real problem at hand, which is poor insurance coverage, insurance loopholes, and high out of pocket costs and high deductibles.
There's a follow-up question just on that. If FSA and HSA funds could be used, I would think they would because you're purchasing a medication. I would think that would be covered, but I'm not sure on that.
Yeah, I think we're still waiting for the IRS to make a determination on that.
Oh, perfect. Thanks, Jessica. Great question in the chat. What about when my state rheumatology society is not interested in advocacy? So without pointing out anything, one of those non-active states from this year is just one that is more of a CME based state. They like to do their education, get it done. And those states typically are ones that end up falling behind in patient access because we don't have a group of people that really wants to push these access issues, et cetera. I mean, I'm happy, number one, if somebody wants to get with me. Um, about talking to the state societies and why this is important, why they can do that and not violate the nonprofit laws. You know, a lot of these are 501(c)(3)s. You do have to make sure you're paying attention to all that, but you certainly can do advocacy, just being careful with the total amount of lobbying that's there. And I think the key is, hey, look, you're noticing in these states, whether that be states that don't allow, you know, medically integrated dispensing. We have several of those. Those are usually states that CSRO has not been very active in. Copay accumulator issues. These things are hitting your patients, and if we don't get together and do something about it, which I'll tell you, I mean, it does move slowly, and I saw kind of one thing about, hey, look, you know, it's all about politics, et cetera. Over the last 13 years of advocacy, I can tell you that this stuff makes a big difference. We chip away; it's very slow, but anyways, we're happy to discuss with your state societies how we could get involved. And again, there's grants to then get the group together to organize, maybe even put together a Hill Day, et cetera.
Yeah,
Another
I'd love
question.
to add to that, Dr. Bradwell, that if individuals still are kind of lacking an advocacy component in their state and looking for more, CSRO is always looking to develop relationships with key advocates. So we have lots of opportunities to do all the forms of engagement that Darcy mentioned. So testify before a committee or possibly meet with your state legislator and invite them to your office, author an op-ed that we can help you place on, of course, our policy priorities. But if that's something that you're interested in, again, whether you have a state rheumatology organization that is particularly active or one that's a little bit more dormant on advocacy issues, you can email info@csro.info and just let them know that you are interested in becoming more involved with advocacy and that you'd like to be a key advocate. And we're happy to start to provide you with more information about opportunities to engage.
Jessica, are you prepared for the question? Because this is all brand new, and we had a busy week last week in PBM world. So either some short comments, can't dive too far into it on the FTC thing, and then also in the appropriations bills, just some broad strokes about are these good things, bad things? What are we going to see sooner, maybe later?
Oh gosh, so
Yeah.
much PBM stuff, which is exciting, right? We love that there's so much PBM stuff. We had to explain what a PBM was about 3 years ago if we walked into a room. So now to see so much action around PBMs is really exciting. Um, a couple of areas on PBMs. So one, in the Consolidated Appropriations Act, which is what kept the federal government open um, after January 31st, we saw two pretty major PBM pieces of legislation enacted into law. And we should really be doing a victory dance. We don't do victory dances enough in this industry because we are constantly fighting the next battle, but CSRO mini victory dance because we have been advocating for PBM reform on delinking and rebate pass-through for years, years and years, and doing a lot of hard work to lay the groundwork. And again, that does not happen overnight. That takes years of meetings and walking into rooms and reminding people what PBM reform is and reminding people what delinking means. And so for those of you who are not aware, at the federal level, Congress passed and the president signed into law delinking for Part D. So not quite as expansive as we would love for some of our expensive medications in Part B, but for Medicare patients exclusively, Part D delinking. So that means that the PBM cannot receive compensation based on a percentage of the list price of the drug. Instead, they need to be paid a flat rate. That is already happening in the market with some of the transparent PBMs that are around. So we know that it's a functional model that can still thrive in our market. But this will hopefully reduce the incentive to drive higher list prices as the preferred drug on the formulary. The second area that was passed in the Appropriations Act was also rebate pass-through. So Darcy talked about rebate pass-through before. There's a couple of different types of rebate pass-through, but the one that Congress passed, which is actually pretty major, is for ERISA plans. So these are for the large employer plans. That is approximately, depending on state to state, between 75 to 80% of the insurance market. So that would require 100% rebate pass-through back to the plan sponsor. So the plan sponsor being the employer. And while we would love for it to go back to the patient because that will immediately reduce patient out-of-pocket costs, we're actually really encouraged about it going back to the plan sponsor because we think that that means that employers can then provide more robust plan coverage to their employees. So instead of having restrictive plans that have high deductibles, or maybe they're only paying 50% towards your plan right now and you're responsible for the other 50%, through this policy, we are hopeful that those employers will reinvest those dollars back into their employees and therefore remove some of the cost sharing in terms of premiums and reducing premium cost sharing with their employer. So we're encouraged to see those happen. We still need to make those happen at the state level. We're going to continue to make those work. There are a lot of other things happening in PBMs around both the FTC, as you mentioned, and also the Department of Labor is looking at PBMs and exploring responsibility that PBMs have to disclose information about their drugs so that employers, again, can take full advantage of being fiduciaries. So lots of things happening around PBMs, which are all very exciting. CSRO does a great biweekly newsletter. Darcy authors many of those articles, as well as other folks on our team. There last week was an article on PBMs. So please continue to subscribe to those biweeklies. If you are not, please go on to csro.info and sign up.
Truly a victory lap. I could not believe all that happened in 1 week. I mean, you work on stuff for years and then it all comes in from various directions. Darcy, did you want to address the telehealth question?
Sure, yeah. So I think there was a question in the chat about, should we expect future extensions for Medicare coverage? I know Congress, just as part of the appropriations package, had extended it for another 2 years. And kind of what can we expect moving forward? Will they extend it again? Will it be kind of these like short-term extensions? I think the answer is yes to both. I think Congress understands, the importance of telehealth. While it's been around since the 90s from COVID, it drastically expanded with the pandemic. And I think, to be frank, what we're seeing now is, especially on the topic of telehealth, a lot of Republicans, they represent rural health areas. They understand the importance of telehealth. But just from previously working in the House Budget Committee, any effort to kind of expand Medicare spending always comes with caution. And sometimes that's even behind the scenes from the Democrats, just given, the significant proportion of the budget allocated to that. So I think we're going to see, especially for telehealth and maybe quite a few other health provisions in the future, they'll continue to be funded, but there'll be a lot of these kick the cans. There'll be 1 or 2 year extensions that, frankly, we should count on, but it stinks that every year it kind of comes down to the wire every year. But I think just because the high ticket price of these kind of 10 or permanent 4-year forecast, we're going to kind of see a lot of these kind of short-term windows. So that may change. I think it's a really successful program, but I think given a lot of the financial constraints lately, I think at least for the next couple of years, we can kind of expect, probably next 10 years, these kind of short-term yearly or bi-yearly extensions for telehealth.
Yeah, I wish they would, because they never pass them until they've expired, and so everybody's holding on to they're stopping telehealth or they're holding their claims, and it gets so confusing. So it'd be nice to have some finality. But I agree. I mean, it's kind of they keep on making it happen. So now if they take it away, it's going to be a pretty big deal and not very popular. So I haven't heard about the National Medical Specialty Network by Evernorth, although I can't imagine anything that Evernorth makes is something that I'm going to love. Yeah, I'll take a look at it. But clearly, I mean, anything that's done there has high chances of maximizers, accumulators, et cetera. I know United had a particular one that they were doing that we had kind of cautioned folks into joining, and so, but we'll take a look at that. Thank you. Um, let's see here. I don't know. Does anybody know what the last question is? Advise pros or con on patients joining it? Are there disadvantages or I don't know. Not sure. Any other questions? I'll go ahead and wrap it up. Thank y'all so much. I don't know how much Heart Health has been doing in the background with this map tool, and now everything's in session, and they are furiously following all 50 states. And we will keep y'all apprised. Please look out for your emails. Those QR codes were there. And answer, just click yes, personalize it if you can, but just send it. You would be amazed. They're just bean counting over there in the legislator's office saying how many people are pro this and how many people are con. So super helpful. Again, thank you so much, Heart Health Strategies, for getting this together. And I hope everybody has a wonderful night and hope we can continue moving everything in the right direction for our patients. Thanks for your evening.